Hello, Moral Gibbs, and welcome to Speaking of Everything. With me, I have a very interesting guest, Miss Healy. How are you doing, Miss Healy?
I'm fine. I feel good. I just want to excuse my voice.
Uh, well, it's good to have you in the program, and thanks for accepting the invitation. You've been such an amazing person, Simran, when it comes to healthcare, especially for mental health on St. Martin. And so it's always good to have you in the program. What's happening lately in the field of mental health? Are you still involved or no longer involved? I'm just curious.
Oral, I'm 74 now.
Well, you don't look
I
74 at
never,
all.
I never dreamt I would have worked so long.
Mm.
Yeah, I'm a healthcare professional. So you really want to care for people. And when it comes to a stage when you get a feeling that you're not caring for people anymore, but 80% of your time is attempting to convince people in government who you need to support your cause of what you're doing. When you get a feeling that who can I trust, it's hard to continue. So I decided to let go. I gave back my contract to the board and I said, the way things are going, I have to know that I can guarantee quality care to our constituents on St. Martin, to the patients and the families. That's the way I ran it for 15 years. If I can't do that anymore, I'm gone.
It's so bad to hear. I'm sorry to hear that because you've been very instrumental. You've been a pioneer in this field, Simran. You were able to convince a lot of people to come along with this when it wasn't sexy at all.
Yeah, I don't know if I want to call it sexy. It was a need. It was an urgent need. I don't know if you remember, I worked for Whitechapel Cross for
Right.
12 years. And at one point, we had like 12 psychiatric patients in St. Martin's home, all being treated wrong. Staff didn't know how to deal with it. Families were in a confusion. So when the opportunity came along to start mental health, I decided it's really something we need to get going on the island. And I did. And my main focus has always been to provide quality care to the people. If I was not getting it properly funded, I would not do it. What government has to stop doing is bawling out that healthcare costs money. Healthcare costs money. But you have to find a way to be efficient. And I sincerely believe that the Little Mental Health is one of the most efficient healthcare providers on the island today. We do community care. We do crisis care. We do day treatment. We have a huge outpatient with psychologists, social work, occupational therapists, literally everything under one roof. In any other country, it would be all different organizations, different administrations. It would cost more. So don't come tell me the money is not there. Since 2014, we have not gotten 1 cent from government. The AVPZ fund has more than 1 million guilders in that fund. They owe it to the people. Mental health, majority is chronic. If you're in care longer than 90 days, you're entitled to AVPZ care. It's not adequately being provided to the people. I was on retirement when Hurricane Irma hit,
Right.
and one of our patients killed somebody. Why? Because he's a severely ill person. And the nurse couldn't find him to give him his proper medication to avoid him becoming aggressive. It was a really very bad situation, very confrontational for the police officer involved, for the nurse involved, for the families involved. At that point, we need to get funding for an adequate building so that this type of patient can be better monitored, can have a place to stay, doesn't have to be looked for on the road. I managed in October 2021, we got approval that the World Bank was allocating $8 million to mental health predominantly for that purpose.
$8 million or dollars?
Dollars. Today, government wakes up like they know nothing about it. It's not mental health money, it's their money. They flat tell me they have another purpose for the money.
Wow.
Now, how can you trust your government? I'm sorry. I'm very sorry. They want to do community care. I told them community care is something we urgently need on the island, but mental health is not community care. I invited them, come with me to Bonaire. I'll show you a community health center that is running privately there beautifully. A community center means that you have a center with a general practitioner, social worker, dietitian, physical therapist, everything, social work, everything that
Right.
a patient could need. That's not mental health's job. And now you want to use that money for that purpose because you did not know about the project. It took 4 years. A project that comes through the World Bank has to be approved by the ministry, by the minister, by the Council of Ministers, then by a steering committee that consists of the island government, island government, Holland, and the World Bank. Then it's finally approved. It took 4 years. And now you have Alzheimer's. You don't know about the project. How can you, when you're working for the population of St. Martin, can you trust your government anymore?
Based on what you just said, what that means for St. Martin?
It means when I first applied for the funds, we had 25 patients living on the street.
Right.
Today, I estimate it's about 50. How can you ethically care for patients on a road? What is going to happen? I don't know. One of the things that is increasing is drug abuse. We still have not made addiction legally an illness. In the whole world, it's an illness.
And in St. Martin,
It's still not an illness.
Wow.
I mean, so they look at us, crisis, Turning Point refuses to do a crisis. Most crises that come in are addiction or a combination. Then we have to send them to Turning Point, who then gets subsidy, then doesn't get subsidy. It's not, so the patients come right back. I mean, if there's no continuity, is there no vision on what we need on the island? It's, I don't know, more serious incidents will happen. If that's what our government wants, let it happen. Ministry of Health, Director Healthcare tells me, I'm not going to let you build a building and the minister open it and it will be empty. I'm like, woman, please look on the road. When is that building going to be empty? You have never invested in healthcare. Never. The building we are in now was a Windward Island Bank loan that we paid off. Because we paid off that loan, we could buy land in St. John's. We have land now to build on. And now you have a different plan. Our government has to start having a vision, an overall vision for the island. Do we want to care for our people or not? Or is it about my position, my position, my position? Are we also always in fear of losing out? Running mental health didn't work like that. I had to fight like a dog to get it off the ground. I had to fight like a dog to make people understand that it was not about me personally, but that it was about sick people and their families. 90% of the families take care of their patients till they can't anymore. When they really can't, that's when they end up on the road. It's not that people just shove their patient, their relative out on the road on St. Martin. It doesn't happen like that.
Ms. Healy, I've known you for many, many years, and I can recall the difficulties that you were going through when you wanted to start the Mental Health Foundation. And I'm sitting here listening to you, and let me tell you, it's not nice. I can't imagine that the government, not just one government, all the governments that I know treated you that way. I can't understand it, because here you have an island. We go to the polls every 4 years. We elect people for office to talk about all the different plans for the island. Healthcare should be a priority. Mental health is very important.
Look, if you go to the doctor for a stomach problem or for a broken arm, you're okay. The most important part of your body is your brain. And most things are happening in your brain. If I move my arm, it's because my brain lets it move. It's not supposed to be a stigma. And I think we also have an information and prevention department in mental health. I think we came a long way away from being a stigmatized organization. I sincerely believe that mental health today by the population is respected and approved of. I'll tell you a nice story. I was walking past the cultural center in town, and I met a lady who did some sewing things for us in the past. She was talking to another lady, and the other lady says to me, "Are you from mental health?" I said, "Well, I used to be." She said, "Kudos to mental health. I have to compliment you guys." I said, "Why?" She said, "I was a mess. I was treated by a psychologist, 5 sessions," he said, "and I'm a new person. I'm sitting here today. I can sell my goods. The other day, somebody stole my rack. Normally, I would be a mess. I just sat there and something will solve my problem." And guess what? An Indian lady was closing her store and gave her a new rack. And the lady's happy. And she's so proud of mental health. Where is our government? With their pride, with their vision, and we want to care for people, not only mental health people.
Before you, we used to send patients to Curacao.
Correct.
And that doesn't happen anymore, right?
No.
And why?
Because the crisis intervention is allocated to mental health. It took me 3 years to get a permit from Minister De Wever to do involuntary care. While we had already built the session. While the staff is telling me, "Eileen, we're doing things illegally." I said, "Yeah, we can't leave them on the road."
Exactly.
We ended up in court for a permit to treat mental health patients. I'm like, we had a patient. This is not a nice story, but I think the population has a right to know. 10 days. It was a middle-aged man, severely crack addict. We regulated, mental health regulated. I asked Capriles, can we free because we only have 1 crisis room? And we had 3 patients out there that urgently needed to come in. You know that government withdrew the permit for involuntary care and refused to send him to Curacao. We do not fly out psychiatric patients anymore. The man ends up, I wrote a letter immediately to all government officials and I said, mental health cannot be held responsible for this decision. It's government now. A week later, I get a call if we can pick up the man off the road from social affairs. I'm like, ma'am, call the health department. It's an asset fee. The asset fee doctor also turned it down. I said, mental health cannot intervene anymore, no matter how bad we find it. It's inhumane. It's what happened. I hung up the phone and I was like, I can't leave it like this. I called the on-call nurse and he went and he admitted the patient. They had to fly him out from the intensive care in the hospital to the intensive care in Curacao, where he died. They footed the bill for the cremation to his niece, who is a single mom with 3 children. Never asked the question if she was capable. Never. And this is our community today. Our government. No. I have no appreciation. I worked long with them and I was very patient. But today, no. You know, I submit a social year report since the existing of mental health in 2006. You know that nobody in government ever read it, knows what's in it. Today they say they have to do research because they have no data on mental health. The data is there. The data is on our website. CPS department, the information department from government tells me we have no data. I send everything to the lady. I see her later. I asked her, did you read it? She says, no. You don't want to. They don't want to care. It is really, really bad.
You know,
and now elections are coming up.
yeah.
Like you, I have no clue who I'm going to vote for. Yeah. I have no faith in nobody right now.
You know, I tell people after almost 40 years in this business, I don't see any change.
28 years, me.
Yeah.
Look, I offer them, let's come together and start an overall healthcare vision. Years ago, I was working for White Yellow Cross.
Right.
Urine got pissed on me. I have a vision. I said, where is it? All these documents I signed. I said, that's not a vision. We need to come together. Yes, we need community healthcare. It was way back. I was still working for White Yellow Cross. That prevents people from entering into the expensive hospital care. You know that today we still have elderly in medical center, in a hospital bed where they don't belong for months because we say there's no place to send them. Wow. And we have White Yellow Cross, we have district nursing, mental health and district nursing tend to those patients in the community. You can enhance home care with the 1 million AVPZ money we have. Nobody wants to talk about the 1 million. I don't know why. I keep asking it. SVB says they have to invest abroad and they have to invest. I said, no, this is money that every single person working on St. Martin pays into and still does. Yeah. And you owe it to them. Yeah. Let's do something with the money and care for the people, yes, in the community. But don't use the 8 million that is a specific project for a specific goal. If you had a vision, you would be there for the total health care. You know, when I came to live here, I found a report in White Yellow Cross. It was a research done with regards to building the now St. Martin Medical Center. It advised if St. Martin does not enhance community care, the hospital will be bankrupt. Medical center was bankrupt from the beginning to the end.
Right.
You still didn't have community care. And now, my poor 8 million will just about cover what I need. And you want to use it for community care? What are you doing with your own budget? Oh. What is the government doing? Do we know that? Are they transparent? If you ask them things, they tell you it's government confidentiality thing. They don't give you nothing. No transparency whatsoever.
You know,
why? Do you need the money for something else? It's not yours. I never told anybody the money was for me. I'm happy with what I have with my income. I worked hard. I don't need any more. I'm 74 years old. My kids are taking care of themselves.
Yeah, no, I see your passion. I know the kind of person you are. You really, really care about.
I learned to love St. Martin. Next thing, we didn't talk about the staff of mental health.
I'm going to ask you to hold that thought for me. I got to get to a quick break. We're going to come back.
Okay,
And talk
yeah.
Yeah, in case you just joined us, I'm Earl Gibbs. My guest is Miss Healy, a lady that I think is really responsible for bringing mental health to the forefront here in St. Martin. Started the Mental Health Foundation, quite an advocate for mental health, and you'll listen to us on FM 99.9 radio station, YouTube, Facebook, and TV Carib. When we come back, we'll continue speaking with Healy right here on Speaking About Everything on 99.9 FM. Right.
Make use of WIB mobile banking with easy access and direct usage of face recognition, PIN code, or fingerprint. Download WIB mobile banking app and make your transaction from anywhere at any time. For more information, visit wib-bank.net/quick-login.
FM 99.9, that's Hot FM 99.9 radio station here in St. Martin. If you'd like to advertise, give us a call, 520-6070. That's 520-6070. Hot 99.9 FM radio station. And in case you've just joined us, I'm Earl Gibbs right here and speaking about everything with my guest, Miss Healy, and we're speaking with her about mental health. You were going to tell us about the staff just before the break.
Yes, Earl. I think mental health was built with local staff. Really. Administration was local. It still is. Care staff is local, still is. Our psychologists, the only problem are psychiatrists.
Yeah.
There's a worldwide shortage, but right now they have two very good psychiatrists, one from Suriname and one from Portugal. They're doing a huge job. The staff is also passionate, not only me. That's why I dare to say things and dare to be passionate. We have a 24-hour availability. They're always there. And they go to situations whenever it's needed. In the end, if we continue like this, they will not be able to manage. They need the police officers to support them in dangerous situations. Till now, I must say, the police was so happy when we started because now they had support.
Right.
Things are changing. Younger recruits are coming. They don't know the history. They don't know why they have to assist. But it goes both ways. Sometimes the police is there. They call the nurse or vice versa. It's a cooperation that has been going on formally and informally for 15 years. And it really works good. You never hear things like in the States where they get beaten or, they know. They know to call us. They know to get assistance. But they also get attached to their patients and they want to see a future.
Right.
If our government doesn't appreciate the work they're doing and doesn't see the need that the most of the psychiatric patients can have a job, can do things, come on. They get demotivated. Really, from the time I was working there, the only person who would demotivate my staff was the government themselves, and not me. Government officials would tell me I'm firing staff. When I retired the first time, after 10 years, I tallied how many people I fired. 2 in 10 years. And there was really cause for it. I never fired anybody. If people don't agree with our policies and procedures, it's a huge responsibility that they have, and it's a very, very difficult job. You have to constantly be observing. You have to constantly be aware. You have to know when to approach the patient and when not. You have to know when to ask the doctor, do we need to change the medication or not? you need to know how to deal with distressed family members. It's not an easy desk job. You sit there and you wait and things will happen. It doesn't work like that. And they get emotionally involved because the patients are there for years and months. Not everybody is lucky like the lady I talked about in 5 sessions and I'm a happy person. Doesn't always go like that. That lady came on time for care. A lot of people don't. If they don't come for care on time, it becomes chronic. So, and it happens a lot. Drug abuse, young kids, and they come in too late a lot of times.
The last time I saw you, you told me the amount of outpatients was over 1,000.
It's approximately around that amount right now, yeah.
And it seems like it's just growing so fast for a small island like St.
The
Martin.
amount of crisis interventions is terribly increasing. And that is because prevention is lacking. Community care is lacking, if they want to hear it like that.
Yeah.
But we have to get together with schools, with government, and be out there and continuously promote
Right.
the pressure children have today, avoiding it. Prevention in drugs, we need to do that.
Yeah, I just it just